So today I'm going to talk about the MSA injection, and MSA stands for middle superior alveolar. And whenever you're giving an injection, the first thing you want to do is to debride the site and dry it off with gauze. So I'm just going to dry off the tissue. And drying it off does two things. Number one, it prepares the site for the topical, so that'll work better, but not only that, it removes some of the bacteria, so it cleans the site, and that's even more important. So make sure you always prepare the site properly. And for the MSA injection, the landmarks are the height of the mucobuccal fold directly above the second premolar. So here's the second premolar. You're going to go to the height, the highest part, which in this case is right about here. And she has a little frenum right here. So if that's the case, you're just going to go right behind it. And that's going to be your site. Now, one of the most common mistakes with the MSA that I see beginners make is they get a little bit too close to the ridge. And then you're not going to have any room for the solution to come out. And you're not going to have any room for the needle to go in. So it'll be really shallow. So it's better to err on the side of being more out in the vestibule than really hugging the bone there. So you just want a little space, usually about, 4 or 5 millimeters out into the vestibule. Okay, so now I've debrided the site and I'm going to apply topical. And notice my topical isn't a huge glob, but there's enough to do the job. So we're just gonna place that up there, exactly where you're gonna go. And then usually the cheek will hold it in on this one. And we're gonna wait at least a minute. 2 minutes is ideal. The MSA nerve is actually present in only about 28% of the population. So about 72% are missing this nerve. And so when that's the case, the PSA will innervate those two teeth. Structures that it anesthetizes are the first and second premolar. It also gets those pulpal tissues. It gets the facial gingiva associated with those teeth, and it gets the underlying bone on the facial side. It also gets a little bit of the lip area around the injection site. It does not get any tissue on the lingual side. Okay, so the topical's been sitting on there for a minute. And you want to just take another piece of gauze and just remove the excess. And now we're ready to go. When you retract, it's really important to get distal with your finger. You don't want to be like this and having the tissue flop over the site. So get your finger way back there and pull it really tight. Okay? And a lot of times that lower lip will be there, and that's okay. You can kind of use it almost like a little fulcrum, okay, to stabilize the barrel. And what you want to do is you want to be parallel to the alveolar process. So I'm going to go in and you want to be nice and straight. I'm going to go out into the tissue and I'm going to penetrate the bevel barely, aspirate. It's negative. I'm going to deposit a few drops. And then I'm going to wait 5 seconds. And then I'm going to proceed. Now Julie is one of those cases where she is just so shallow I can barely cover the bevel. So I'm there, I'm going to deposit. And when you start out very slowly. So when you start depositing, you're basically just doing those comfort drops, and then you're going to wait before you start to speed up. Okay, and notice that I'm parallel to the alveolar slope. And then I'm going to withdraw.